Herceptin. Herceptin mechanism of action. What is Herceptin? It is a targeted therapy anti-cancer drug called a monoclonal antibody. Works through targeting of HER2 receptors to help fight cancer cell growth. Moving on to the mechanism of Herceptin. Herceptin is a monoclonal antibody which is designed to target HER2 receptors. These are transmembrane receptors on both normal cells and the HER2 plus tumor cells. HER2 then plays an important role in the signaling of network that drives cell proliferation. Moving on to the second step here, which involves the blocking of intracellular signaling pathways. Herceptin, through the blocking of intracellular signaling pathways, will then attenuate the signaling of transduction downstream. Herceptin then will promote the apoptosis and arrest of cell proliferation to occur. Moving on to the third step here, Herceptin will then flag the tumor cells for destruction through the body's immune system, known as a antibody-dependent cellular cytotoxicity, the activation of natural killer cells expressing the Fc gamma cell receptors. This is then bound by the Fc domain of Herceptin and is mainly what leads to the antibody-dependent cellular cytotoxicity to occur. And on the final step, the prevention for HER2 shedding, which is then what prevents copies of HER2 from spreading throughout the body. The research article I chose is titled Herceptin as a potentially valuable adjuvant therapy for patients with human epidermal growth factors, receptor 2 positive advanced esophageal squamous cell carcinoma. And the purpose of this article is to understanding if HER2 is the best therapy for advanced HER2 positive esophageal squamous cell carcinoma, also titled as ESCC within patients. On the right side here, we have our three cancer antigens, which are the CA125, the NSE, and the CYFR211. And the data on the right side shows how the introduction of involving tumor treatments with Herceptin combination of chemotherapy yielded positive results as we have introduction of the chemotherapy and Herceptin combination shows how on the right side that the more addition of introducing of this drug has lower rates of there being HOI2 within the body. And my interpretation of this data shows how Herceptin is a good potential therapy for patients who have HOI2 positive ESCC in advanced stages and should be used for more squamous cell carcinomas in the future. Continuing on from the previous research article, I wanted to include a visual aspect of what is occurring during this treatment. And on the right side here, we have an image showing a cancer patient of esophageal cancer. And what is happening here is how the chest masses before and after Herceptin combined with chemotherapy end up decreasing over time. So these arrows help indicate where the tumor is at. So the white portion here under this arrow, under A, at 2018, 11/15 is when the first data was recorded of this tumor mass. And moving on, after a few months, in 2019, on the 1st of the 23rd, we show under the red arrow how the tumor is decreasing in size of the mass. This shows how effective the Herceptin and chemotherapy treatment is regarding esophageal cancer patients. Cancer disparities. The article I chose to help talk about this is Racial Difference in Disparities and Cancer Care and Outcomes. Where's the rub? And on the left side, we have males and females being compared based off of these three cancers: breast cancer, lung and bronchitis, colon and rectum cancers groups. And we also have the death rates of these three cancer groups being compared to based on these sexes. And the number one and the most new cases of this is at breast cancers, and number two is at lung and bronchitis cancer, and colon and rectum cancers is at number three. Now the death rate changes this, where we have now breast cancers at number two, lung and bronchitis cancer at number one, and colon and rectum cancer at number three. Now the death rating of males compared to females based on these cancers is much higher in males compared to lung and bronchitis cancer compared to females in the breast cancers. Now moving on to the right side, which is comparing the races of white and black. We have our comparison of localized, regional, and distant. Localized is the early starting of cancer and is easily treatable compared to distant. You want it to be treated around in the localized area as a higher progression of survivability occurs within this area. And this is involving the three comparison of cancer groups: female breast cancer, you have the lung and bronchitis cancer, and colon and rectum cancers. And we have seen a common pattern here where whites are more diagnosed within the localized stages compared to the distant, where blacks are finally diagnosed in the distant stages more than whites. Now, a way that I believe that this can be resolved and based on all of this cancer disparities is how racial and ethnic minority groups can receive the same treatments. And it is important that people and researchers devise innovative strategies to include novel clinical trial designs to ensure that every single patient receives a standard treatment and participating in cutting edge clinical trials to give them a chance at fighting these types of cancers and that everyone has an even shot at making it through these trials. And here are my references.